today we are interviewing Melanie Stoudt. Melanie is a LPC and a certified EMDR therapist and approved consultant through MDR. I've known Melanie for several years. I have consulted her on difficult, complex cases. Trust her clinical judgment. She's, I would say, one of the most advanced therapists that I know in terms of treating trauma. We're going to start with just the basic question of what does trauma mean to you?
Well, in, a little bit of preparation for this interview, I was looking up, all right, what is the definition of trauma? Because it really is used in a lot of different ways. And it was interesting to me that it comes from the Greek word wound. And I think that really captures this, what trauma is. It's a wound. And it's interesting, years and years ago, it really was just thought of as physical wounds. And over time, and, now I would say primarily when people think of trauma, they really do think of more of the, mental, emotional, psychological wounds.
You've been in this field over 25 years, so you've seen the gamut of definitions changing and modalities changing and what we used to think and what we think. And probably we're going to have a different conversation in 5 years as we learn even more. What does that mean when people read trauma-informed therapist? What are
Right. Well, it's interesting as you say that. 25 years ago, no one talked about trauma. Like that wasn't anything I had any, idea about. And interestingly, even when I was trained in EMDR, which was 2009, so, almost 15 years ago, I, looking back, I was not trauma informed. So it is a really newer kind of approach to assessing and working with clients. And I think that it is like picked up speed, and many, many more people are now having an awareness of, what is trauma and then the impact on that. But trauma informed really comes from this place of being able to, look through that lens of what is the wound, because every individual will experience an event in different ways. And so it really is being able to, meet someone where they're at and being able to really be curious and understand how they have, been impacted by the experiences in their lives.
So how does somebody know, if this is healed trauma versus unhealed trauma? How does it manifest in a person?
So, it's interesting. So really, it is subjective, right? I'll often say to my clients, you are the expert of you. Really trusting that as someone, comes into, to, work with myself or other therapists, trusting the client, they're the expert of themselves. So is, again, if we, can use that word wound, it's such a, common, concept. If we do have that physical wound, is it healed? Right. When you push on it, does it hurt? Is it bleeding? Is it, still need a Band-Aid on it? And so really that is part of, being able to assess, is the wound causing any disturbance? And in EMDR, we ask that question all the time. How much disturbance are you experiencing now when you think about, whatever particular event or experience someone has had trouble with? And that's subjective. It's based on someone's own ability to be aware and notice how they're feeling about something.
Okay. So you would say if that wound, and I love that word, we can all relate to emotional wound, right? So, and people have asked me, like, if I was abused in childhood, should I be having therapy? And my answer is often that. Is it bothering you? Is it disturbing you? Is it impacting your daily life? Because if not, I'm not sure I would go dig it up. What do you think, Melanie? Do you think that maybe it's suppressed or repressed? You know what I mean? Like, how would someone really know?
Absolutely. So that is a very good question. And sometimes it's not so black and white. You're not able to just so readily, assess it. But just to keep it simple, it is just as you're saying, it really is trying to help the client notice, well, is this in the way, in your daily functioning? Because events, and I will say that sometimes the word trauma gets, interchangeable with the event, as if the event is the trauma. And I really have been thoughtful about that. The event itself is an experience. How it hurts somebody is the trauma. And I think it is, I mean, I'm sure if we looked up definitions, there's probably a little bit of, overlap. But what's so interesting is, if you just take, a car accident. Some people have been in car accidents and, the event itself has strong emotion to it and an elevation of emotion physically, the heart's racing. But afterwards, the person may not feel any wounds from it. Literally, physically, they might come out okay. And then they can talk about it. They get back in their car. They might have a good story to tell. So the car accident isn't actually trauma. It's, really looking at what was the impact on somebody. And for other people, they have that same experience, that car accident. And then they will have panic when they think about driving. The heart races, they have fear come up, they start to avoid, getting into cars, right? So the trauma is their emotional wound that it impacted them. And, probably more than today's episode to go into the why does that happen, right? How do things get stuck in the brain versus get processed? Because we're naturally meant to have experiences, be able to process, move through the experience and come out on the other side and literally look back on it and go, wow, it was a pretty big deal, but feel calm. And so, you asked about, abuse, sometimes someone is able to really be present and really be able to assess themselves and say, that was a big deal. That was horrible. They're able to put responsibility where it lies, not on them, and be able to notice the event for what it is and, be able to function and not have that impact them. So we really are trying to assess what's been processed because that's what we try to do in therapy is have someone come out on the other side of it and not have that disturbance stay stuck.
Yeah, absolutely. So when I love that you kind of differentiate a little bit that the same event could happen to multiple people and one may walk away traumatized and the other, it's just a trauma event, maybe, or whatever word you want to use. What are protective factors? Like, what are the protective factors or the reasons that would happen?
So, I mean, that's a complex question. And I would say if we just really are honest, sometimes we don't know. A lot of it may be theorized. What we do have an understanding that in very early development. And really, we can go back to development before we're born, and then in those early years, those pre-verbal, years of development, where, our brain is really building up the foundation of being able to respond to, to safety and danger, being able to have an emotional capacity to, stay more, regulated or balanced. So when we have a good enough is, kind of a way to notice it, a good enough, nurturing, stable, safe, secure development. We have this brain that then has a very solid foundation.
Okay.
So that when there are disruptions, and you can even think, if you've seen any kind of, a baby, a toddler in any type of distress, right? Like, we're meant to cry when we're hungry. We're meant to, start sobbing when we fall. That's a disruption. If there is a solid, secure foundation, being hungry, falling and, getting a gash in your arm, we're going to be able to recover from it. So, as opposed to someone that has very, what's called insecure, people are familiar with, the term attachment, that is, insecure attachment, not feeling safe. It's really the brain not responding as if we're safe. That is going to put someone at risk then to have an event be traumatic, right? Be wounding. And so, over the years, if there is more chaos, less stability, more insecurity, and or actual danger, that can have a pretty profound impact on someone years down the road, being in the car accident and not, the brain not being able to move through that event in a way.
That has come out in both of the other two areas with trauma, which I think is an interesting point, that most of us agree that early attachment wounding is a precursor to whether someone may develop PTSD or dissociative disorders, and the linkage between the two. So wouldn't attachment be part of the healing?
Yes. So let me come back to that question and just to clarify, because I think it is, again, we're, just every day, right? Learning and trying to understand how all this links together. So someone that does face a life or death event, that most people would actually label the event as traumatic. They're in war and their platoon gets blown up, right? They are kidnapped. Of course, that's traumatic. And just like you say, there doesn't have to be, an assumption that they have any early trauma. That in and of itself can disrupt how the brain is able to move through the event. But we do differentiate that as more of a simple trauma, and PTSD, absolutely can result. The good news, so to speak, is it doesn't seem to generalize to all aspects of our daily functioning, but really is kind of that classic. You hear the loud noise, and you're jumping under the table. And again, the good news is, with, appropriate therapy, right? Therapy that's really targeted to reprocessing that trauma, which there's several out there, EMDR is one of those. That person's going to be able to move through that much more easily because they do have that more stable foundation. I always like to, let people know, there isn't something wrong with you. if, and something happens and you're like, I've been fine. What's wrong with me now? Something did happen that was a life threat. Okay, but back to your question, what do we do with early attachment? Again, good news. There's been a lot of advancement on, and I'm going to speak specifically, the EMDR field, of being able to work with the brain, and it's really through the body. Many people are familiar with the book, The Body Keeps the Score. It was a bestseller. And basically it's about, yes, our body, how our bodies respond to, they're connected to the nervous system, which connects to the brain. We don't have to have memory because, before 3 years old, there's very little, if any, actual memory, because that part of our brain wasn't developed, to be able to process those early pre-verbal and again, even pre-birth attachment wounds. My training really goes to being able to hone into how the body is responding and then how the emotions respond to be able to process and heal. And it's really through kind of what's called a repair what we didn't have, because attachment wounds are mostly about what didn't happen. Sometimes what did happen, but it's often what didn't happen. So that repair of kind of being able to pretty cool heal ourselves with what we can get at the time.
Yep. So you've stumbled on to complex trauma, developmental trauma versus single incident or simple trauma. I get it. I like distinction saying, and I too have had that experience where what we would call big T's in EMDR, big events, the wars, catastrophic events, disasters, easier to treat than complex developmental trauma that's been chronic over time, because often people who are traumatized later in life do have some of those resources that will allow them to process through it. But there's a difference when we treat people who have complex trauma. And that's also another word I think is kind of newer to the scene, and the, I see and all that as CPTSD. So complex trauma, attachment trauma, what does it mean?
So again, it's interesting. That's also has a few different definitions that are out there, but basically complex trauma, for the most part, begins in earlier development or in childhood. It often is about a relational trauma. And, to give a more simple, example of what that would be, you have a parent and that parent is very critical. But child is crying, something bad happened. They blame the child. They ignore the child. They're not meeting their needs, right? So the child is feeling insecure, not nurtured. This happens over months, years. That's just how these interactions go. It's inconsistent. At other times, the parent shows up. You're not sure when they're going to be critical or when they're going to be kind. So that is an example of kind of what trauma looks like when it's occurring in the childhood. It can also be someone that is close to the child that really then perpetrates a more wounding event, right? It might be not verbal abuse, physical abuse, sexual abuse. Often complex trauma has, for the most part, that developmental trauma and ongoing, difficult events. And then it kind of becomes that, cycle, right? Where they're more vulnerable to being wounded, just keep using that word, through friendships, or later relationships, and they become more vulnerable to dangerous situations or being taken advantage of. You know, complex trauma can be multiple abusive events just in and of themselves. But most of the time they have this relational component.
Many clients that have had the neglect trauma or emotional trauma haven't really been validated that it's trauma, because it isn't this thing they can touch. It's more of an unmet need. It's more of something that did not happen. And so do you think that people can heal from that in healthy relationships outside of therapy?
If you think of therapy and the number one factor, you know, over whatever, I don't even know, you know, I'm sure it's beyond 50 years now of research, is the relationship, right, with the therapist. You know, the number one factor of what leads to, you know, healing. Can trauma be healed outside of, you know, the therapeutic relationship? Sure. Therapy can be efficient, effective, and you have one person who is more objective, more grounded, as opposed to, you know, just an outside relationship where both are more emotionally, you know, involved. So there can be, you know, it can be a little less linear, you know, so to speak. But, you know, absolutely. You know, there's healing through, you know, you see it all the time where people have these wonderful, you know, stories and experiences of how they healed through, you know, running, through volunteering, through their spirituality, through their pets, you know, you name it, right? Because our brains are naturally meant to heal.
Yeah. I love that. And, you know, I think Peter Levine's book, Waking the Tiger, you know, when he gives the analogy, well, it's not an analogy, he actually studied the animals in the wild, you know, and he would watch the prey and the predators, and he would watch the prey, you know, if they couldn't fight, right? Fight, flight, we're going to run, we're going to try to fight. If we can't, you know, they would feign death and wait till the predator was gone, and then they would get up and they would shake all of that out of their central nervous system. And the animal instinctively knew, I have to get rid of it. Like, I have to get rid of this energy, and then I'm going to go on and play. And it's over. Granted, the animal didn't make a lot of meaning from it like we do, which also traumatizes us. But, you know, just understanding that our body does want to heal. Our brain wants to heal, just like the wound of being hurt. And it's giving it avenue. And it should be a relationship that's safe, number one. So when people are looking for trauma therapist, the necessity to really feel safe with that person, that's probably number one, because as you say, the relationship is key. We can have all of these wonderful interventions and all of these great theories, but if we don't have that attunement with our client, the likelihood of real healing is,
you know, and I'm so glad you said, you know, the relationship has to be safe, because that was one thing I didn't mention with complex trauma. You know, almost all of the time it occurs within a relationship that is meant to be safe, right? So, you know, the classic is the parent, right? You know, you're meant to be safe with your parent, and when they're abusive, that just, you know, sets up that complex relationship, because we're drawn to biologically caregivers to be safe. We're meant to feel safe when we are safe. And so, you know, coaches, right, or teachers, you know, as we're growing up, right, through childhood, right, we're meant to develop, you know, friends, right? You know, we're meant to develop these relationships that are safe. And so when someone harms us, and it's meant to be safe, that just sets up, you know, obviously the wounding. So with a therapist, you know, if we're coming back into the therapy setting, yes, we're like, you know, literally the healing starts with being a safe person. We are in a position and a role where this relationship is meant to be safe. And that in and of itself is foundational for healing. Yeah.
Yeah, and even in what you just said, I think it's important to also recognize who the abuser was matters in terms of, was it somebody you trusted, parent, a grandparent, an uncle, whatever, a babysitter, or was it the mailman or mugged on the street by somebody you didn't know? That matters. Why?
So I like to say it can, because as are saying, it matters, right? The person that you have entrusted, or just naturally they're meant to be safe. If you're dependent on them for your survival, they're meant to be safe. Or if you've developed a relationship of trusting them, they're meant to be safe. That safety, that trust is broken. And so that becomes confusing, because you're drawn towards, again, it may be biological or something that you've developed to feel connected, be protected, or if it's a relationship you've developed, just to trust. And so that in and of itself is broken, if they've been physically, verbally, or sexually abusive towards you, or you've been manipulated, then that also is hurtful. If you don't have a relationship, like if it's a stranger, it is less about that particular person harming you, but more just feeling safe in the world. We're meant to feel safe when we are safe, and that we're meant to, what we were talking about earlier, we see it in the, with animals in the wild all the time, until you're not, until the lion comes, until something happens, when it's a stranger that breaks into your house, or that assaults you. What gets damaged then is your safety, just more in the world, as opposed to the particular individual.
I thought when I first started doing trauma work, particularly treating women with sexual abuse, that it's going to hear a lot about the details of the sexual abuse. It's like, am I going to hear the details? That's
Right.
not always the trauma, and I found that, the trauma is often the betrayal and the breaking of trust. And it really showed me that it's that level of trauma does so impact a person's ability to trust, I'd say anyone, but trust the world if the people that I love weren't trustworthy. And as you kind of sets us up to seek relationships that mimic that, people often ask that, why would we do that? Why, if we have experienced that, are we a little bit more likely to seek or stay in destructive relationships?
So sometimes I like to think of that as, it can get tricky when it's, kind of that, that as if the person is seeking that, as opposed to they're more vulnerable to that, unsafe, or, relation. If somebody has, experienced safe people being abusive towards them, their nervous system is more vulnerable. It's less able to send accurate signals about safety or danger. And so someone from the outside, it's like, if you think about their little neurons, going off, really can more easily, more readily step into a relationship with someone that's vulnerable. And at that point, there's a lot of confusion, that takes place within the brain, because that then gets activated as, oh, somebody that is, meant to be trusting, gets activated with that need to connect, that drive to be loved. And so the seeking is often our natural, want to connect to someone, to be loved, feel important. But there's no more protective, or the protective factors are are way decreased as far as listening to the red flags. That, oh no, this person may not be safe. This person is not treating me nicely. Because all of those negative beliefs then about themselves, I'm not worthy, something's wrong with me, I have no control. Those old wounds get activated. And that then kind of sets up that dynamic for those relationships to either stay in place or, to keep coming back and coming back. So, I like to kind of point out it's a little bit more complex, because there's often people will already have those negative, critical voices saying, what's wrong with you? You can only choose, crappy people, and you keep going back to, get more crap at you.
Yeah.
So
Right.
sometimes to just, kind of have it from that perspective of being able to notice that vulnerability, that really comes from a very natural place of course, we want to connect and feel loved and feel important. Yeah. We're just at a disadvantage to be able to protect or respond when things aren't going so well.
So what got conditioned was this need for attachment and love equals unpredictability, instability.
Our body is responding to an unmet need. That person, if they have complex trauma, wasn't loved, wasn't safe. And so that drive, right? So we talk about conditioning, right? That's a biological drive to seek that love, to seek that, connection, feeling important. It takes over. And this is not the rational brain at all. It, is very much in the body, in that, just, response. And, you'll hear a lot of people say, or clients say, I feel like it just happens. I just, all of a sudden, I'm on the phone with him again, or, we're back in there, and it feels so good to be connected with somebody, right? And it's not about connected and I'm getting smacked upside the head. It's that I'm with someone. And so that is biological, is a drive. And it has not, that was not met earlier times. Again, when we're talking about complex trauma. And so it really can overpower, right, that rational brain, afterwards. Oh, why did I go back to him? I know that he, hits me.
When we're in the lower parts of the body and the limbic system and all of that, like our behaviors and drives are really very unconscious. It doesn't give us an excuse, right? It's not like, oh, I didn't know I was doing it. It's not that. It's just the drive is coming from a place that's not in our problem solving, oh, this isn't the right thing to do, brain. And at that moment, which I think is very validating for people when they hear that. Like, I feel like an idiot. I keep doing the same thing. Okay, well, let's understand why. And because it's a much more subcortical decision that's going on. And we need to get the thinking brain involved so that we could change some of these patterns, but we have to get out of that part of the brain. But what is the role, in a more simplistic way, of the central nervous system and the brain science of trauma? Like, how would you describe that in an understandable way to somebody who doesn't have a background in trauma?
So most people, are familiar with fight, flight, or freeze. So we have a natural built-in response that when we are in actual danger, we go into that fight or flight, which is hyper arousal. Heart starts beating faster, blood's flowing, respiration's increasing. And we're meant to respond to danger, to try to get away from it, to protect ourselves, to stop the danger. And if we are overwhelmed or trapped, our brain has built in, it will shut us down and freeze, which you talked about earlier with, the animals, we collapse. It's meant to, last resort, try to save our lives when we're really in life threat, because, in the animal kingdom, lions don't eat dead meat, right? So, we freeze, the animal conks out, the lion goes away, and boom, right, we're back. So with trauma, when the nervous system is responding, to an event that is dangerous and or life threat, in EMDR, we like to use the word stuck. That emotional and physiological, those responses, engage in the brain, that thinking part of our brain. If you do the brain scan, you really, gets, dimmer switch goes on. We get through the event and survive, and the thinking part of our brain, comes back on. And what appears to happen is, again, really simplifying, but those body sensations, that emotion, those, thoughts from that event seem to get stuck. And there's the trauma, there's the wound. They don't, as the brain comes back online, they don't get processed, again, for maybe a variety of reasons, but they don't get filtered through. I like to use a digestion example. It's if when we're, eating an apple, we take a bite, chew it up, we go to swallow it, and all of a sudden, before we can process it, something happens and that apple gets stuck there in the throat, right? It's like, and the brain is like trying to move you through an event, and then all of a sudden things shut down, that emotion, that body sensation gets stuck. Once the danger is over, that apple doesn't always move down into the digestive system to get processed, to get digested. And so things seems to, to get can get stuck in our brains. And so we survive, just like the apple example, we still can breathe and we can go on with our daily life and maybe not even notice it. Then the next time we go to swallow, that pain gets activated. Maybe we feel like we're a choke, right? Maybe, our heart starts to beat because we're like, what is that? And so that seems to be what happens, in the brain, and really simplifying. But, people are pretty familiar with the word trigger, right? Those responses that didn't get processed get triggered emotionally or in the body. And our brains connect to something called a vagus nerve, which connects to our organs or muscles. And so it sends the signal down to the rest, bodies. And those people are familiar with, my stomach starts to, churn, chest tightens up, or my muscles start to brace. So those are just really those old responses, the apple that got stuck from the event.
Which kind of leads me into my next thought or question for you is the necessity of the body and trauma work. When someone's looking for therapy or they're looking for a therapist to help them treat trauma, what's the difference in a talk therapy approach? Do you think that's effective versus more of a body-based approach?
So absolutely. I think as we're really specifically talking about trauma, we really have found and learned that working with, intentionally working with the body, which could be as simple as, deep breathing. That breath is connecting you to the body in, multiple different ways. EMDR, very much is, integrates working and being attuned with the body. There are somatic, therapists that is just, their focus. Or if we're working with the body, it is likely going to enhance the therapy experience, right? Being potentially more effective, more efficient. It's going to enhance that process.
I have one last question for you. Are we all traumatized, Melanie?
Are we all?
Are we all?
Did, right? I like to kind of say, do we all have wounds? Probably yes, right? And again, if you think about just a physical wound, right? Who doesn't have some kind of little ache, pain, scar, little bruise? And maybe we don't have one today, and a few weeks from now, we have, we experience a little pain. I think what is most important to be able to, ask is how we're responding. And this really is, an EMDR, approach. Is it adaptive? How I'm responding now? Is it adaptive? And you said right at the beginning of this, is it getting in the way of you being able to show up in your relationships, in your work life, in your play, right? You're able to enjoy things. It's not just about you functioning, but are you, able to take in the good stuff? And, for a lot of people, they can have a broken arm and they can still go out and play and enjoy the beach, they can still have a healthy relationship. They can still find a way to, get their job done. So a lot of times it's, are you showing up in an adaptive way? And that, again, as an EMDR therapist really drives, our helping our clients, so that it's less about my checklist of what do you have, and more about the clients. Like, what are you finding is not adaptive anymore of how you're shown in the world.
Right. I like that, it gives us an indicator of maybe wounds that do need to be addressed and healed. I appreciate all that you shared. To give you an opportunity, so Melanie does EMDR intensives, which is a bit of a maybe new concept. I'm not sure how long we've been doing this, 4 or 5 years now, but a lot of therapists are doing this. They're more intensive sessions. Melanie is honestly one of the best EMDR therapists that I know, and I trust her clinical judgment and would highly recommend these intensives. So I'm going to give her an opportunity to tell you, what does that mean and how would you find her if you wanted to participate in an EMDR intensive?
So I, I'm an EMDR therapist, and I did the traditional weekly therapy for many years. And so over probably the past couple years, I really shifted my practice to offering intensive sessions, which for me, they're 3-hour sessions. I always tell people we do take a little break in between. And I look at it as more short-term therapy. They are time limited. They're not ongoing. And it's really meant for someone that does have an idea of what their wound is, and or what's not adaptive in their current life, like what, how they're operating is not helpful. I always like to say many people have a journey, getting to that place. And sometimes people are just aware, wow, something happened and things are different now. So for the EMDR intensives, it's really helping folks that do have some, some readiness. It's some idea of what isn't working so well, what needs some healing. Typically, I use EMDR to help somebody be able to process and move through those wounds. And sometimes when it's, a complex, trauma, we may be just doing an aspect or a piece of the work, because as we've been talking about today, there may be, several levels, but it can really be a relief and give someone some more freedom to be able to move, in their current life when you can get, a piece of the work done. And I found there's something to be said for having the intensives take place really over a 1 or 2 week period. So in some ways, I like to say, you're setting some of your life aside, and really focusing in on moving through what's been stuck. So for some people, that really fits with what they're ready for, rather than just taking little bits, over many months time. And for other people, they actually get to what they need to because they're we're all in. We're just working through these longer sessions, so it allows them to more safely, talk about safety, safely move in and have the time and the space to really move through what's been so challenging to do. So yeah, my website, Melanie M. Stoudt, LPC.com is where I have that information about the intensives. And there is a screening questionnaire that if you're interested, you can fill out, and then I follow up with you from there.
So thank you again, Melanie, for being part of this. I hope to do this again, because you also do a lot of work with dissociative disorders, thing that have a lot of interest in. So hopefully we will get to talk a little more in depth about dissociation and how that's treated effectively. But anyway, thank you so much, and I appreciate you and here to help our community and all your intensives.
You're welcome.
So,
Thank you,
Melanie.
Take care. Bye-bye.